Okay, and the laptop's off. We're just using it as a stand.
Hi, my name's Jenna. I'm going to be your student nurse today. Can you state your name and full date of birth?
Kennedy Trombley, November 9th, 97.
Okay, perfect. Let me just verify. Perfect. Are you experiencing any pain or allergies today?
No.
Okay, is there anything I can do to make you more comfortable before we start?
No.
Okay, I'd go over, shut the door, close the curtains, and wash my hands. Can you tell me your full name again?
Kennedy Trombley,
What is the date today?
April 7th.
And where are you?
CHP,
What are you doing?
doing a checkup.
Okay, patient is A&O times 4. Patient looks stated age, well kept, good hygiene. Speech is clear, mood is appropriate and cooperative. Affect is appropriate for the occasion. And there's no obvious signs of illness. First, I'm just going to start by palpating your scalp. Okay, the scalp is normal, cephalic, and symmetrical. The hair is distributed evenly, as well as the color. It is thick and soft, clean, well kept. There is no lesions on the scalp. I'm just going to touch your face real quick. The skin on the skull, face, and neck are all even, pink, normal for ethnicity, warm to the touch, slightly dry. Now I'm just going to go and shine this light in front of your eyes. Go ahead and look forward for me. Okay, pupils dilated from a 4 to a 3, and go ahead and follow my pen light in. Perfect. Eyes are perla. Can you just pull down on your eyelids for me? Conjunctiva is pink and moist, no lesions. Now can you just give me your hand real quick? I'm going to touch different areas of your face. I'm going to do it with a sharp side of the pencil or a dull. I just need you to tell me where I am touching and which side. This is going to be sharp, and this will be dull.
Okay.
Go ahead and close your eyes.
Cheek dull. Nose dull. Cheek sharp. And forehead sharp.
Okay, perfect. Cranial nerve 5 is intact. Now go ahead and squeeze your eyes really tight. Go ahead and open them, puff out your cheeks, and frown. Okay, cranial nerve 7 is intact. Nose and lips, as well as eyes, are all symmetrically placed on the face. Nose is midline. Lips are pink. Border is regular. Go ahead and open your mouth for me. Okay, oral mucosa is pink and moist. There's no lesions, no edema. All teeth are present. No carriers, no cavities, no signs of appliances, none missing. Can you go ahead and pull down your lip for me? Okay, gums are pink, no edema, no retraction, no lesions. Now can you go ahead and stick out your tongue for me and say ah? Okay, tongue is pink, moist, no signs of lesions, falls midline. The uvula rises midline, and the tonsils are grade 1+. They're pink and no discharge. There is a small lesion here on the neck. It is symmetrical. The border is regular. Color is light brown. It is about 1 millimeter in diameter, and there is just a slight elevation. First, I'm just going to go ahead and listen to your carotid artery with my bell. Every time my stethoscope hits your neck, can you hold your breath for me?
Yep.
Perfect. Go ahead and breathe. And one more time. Okay, there's no signs of bruit, and now I will just palpate them one at a time. Okay, rate is equal, rhythm is regular, grade 2+ bilateral. Now I'm just going to inspect your arms. Okay, hair distribution and color is even. They're equal bilaterally. Color is appropriate for ethnicity. They're warm, slightly dry. Okay, see your fingers. Okay, capillary refill is less than 3 seconds bilaterally. I'm going to go ahead and put your fingers like this for me together. Perfect, no signs of clubbing. Go ahead and squeeze my fingers as hard as you can. Strength is equal bilaterally. Now I'm going to feel for your brachial pulses. Go ahead and put your arms like that. Perfect, thank you. Okay, rate is equal, rhythm is regular, grade 2 plus bilaterally. And I'm gonna go down to your radial. Rate is equal, rhythm is regular, grade 2 plus bilaterally. Okay, now I'm going to be listening to your heart sounds. Right here in the second intercostal space, right sternal border, we will listen to your aortic. Then right across in the second intercostal space, left sternal border, we have your pulmonic. Down to the third intercostal space, left sternal border, we have your Erb's point. Down to the fourth intercostal space, left sternal border, we have your tricuspid. And over here in your fifth intercostal space, midclavicular line, we will be listening to your mitral, and that's also where I will listen for her apical heart rate. You just go ahead and relax. I'm just going to listen with my diaphragm first. Okay. Okay, now I'm just going to switch from my diaphragm to my bell, and I will be listening at the mitral point for her apical heart rate. I would listen for 1 minute. And then I'm going to go back up the same way, so to the tricuspid. And then to Erb's point. Pulmonic, and aortic. Okay, heart sounds were good. No signs of S3 or S4, and then there was also no murmurs. S2 is heard louder up here at the base of the heart, and S1 is heard louder down here at the apex of the heart. Now I'm just going to be listening to your lung sounds. Every time my stethoscope hits you, go ahead and take a deep breath for me. Okay. Okay, now I'm just going to be listening on the posterior side. Can you go ahead and swing your legs around here? Perfect. Lung sounds were clear, no signs of wheezing or crackles. I'm just going to have you stand up and face that way. You're going to feel a slight thump on your back. I'm just going to test for CVA. Let me know if there's any tenderness.
No. Nope.
Okay, and then we have you bend over. I'm going to check your spine alignment. Okay, spine alignment is good. Hips are aligned. Go ahead and stand up for me. Shoulders are symmetrical and aligned. Okay, can you go ahead and sit back down for me? Now I'm going to have you lay back and go ahead and pull up your top a little bit for me. Okay, the abdomen is pink, normal for ethnicity. Hair distribution is even. The umbilicus is inverted and placed midline symmetrical. First, I'm just going to listen. Just go ahead and relax. Okay, bowel sounds are normal active. Right Right here in the right lower quadrant, we will have the ileum and the appendix. In the right upper quadrant, we have the gallbladder and the liver. In the left upper quadrant, we have the spleen and the stomach. And then in the left lower, we will have the left ovary and the sigmoid colon. Do you have any tenderness in any areas of your stomach?
Nope.
Okay, I'm just going to do a light palpation. Let me know if you have any tenderness.
Nope.
Okay, and there's no signs of masses or enlarged organs. Go ahead and sit up slowly for me. Okay, and there was no signs of jugular vein distension. Go ahead and swing your legs around this way for me. And go ahead and pull your pant legs up as far as you can. Okay, legs are pink, normal for ethnicity. They are warm to the touch, a little bit dry. Hair distribution is even. There's no signs of edema. There is a small lesion right down here. It is symmetrical. The border is regular. Color is light brown. It is about a pencil tip in diameter, and there is no elevation. Okay, now I'm just going to go ahead, have you swing your legs around here for me. Go ahead and push forward and push back. Perfect. Strength is equal bilaterally. Go ahead and swing your legs around again for me. First, I'm just going to feel for the posterior tibial pulse. Okay, rate is equal, rhythm is regular, grade 2 plus bilaterally. Now I'm going to have you take out your socks for me, please. And now I feel for the pedal pulse. The dorsalis pedis pulse. Rate is equal, rhythm is regular, grade 2 plus bilaterally. Okay, you can go ahead and put your socks back on and roll down your pant legs.
Okay.
And then whenever you're ready, I'm just going to have you get up and walk to the end of the room and back. Okay, patient was able to get up and go without any troubles or dizziness. Gait is steady and even. Now I'm going to have you stand with your back, it would be to the bed. I'm going to have you close your feet together and put your arms at your side, close your eyes. And I would have her stand like this for a total of 30 seconds for the Romberg test. Okay, perfect. And then you can get back in bed. Here's your call light. Is there anything else I can do for you?